Hello, my name is Dr. Ajang Farid, and I'm a forensic odontologist from Budapest. I was very honored when Dr. Parul asked me to give a short presentation about some child abuse cases that we have had experienced here in Hungary. I would like to present to you two cases that we have had in the past 6 to 7 years and discuss those cases with you. I am a bite mark specialist. As a forensic odontologist, I deal a lot with bite mark analysis in criminal cases, and unfortunately we find bite marks in assault, in family violence, especially in child abuse, which is the topic of the conference you're dealing with, in self-defense, in sexual assault, and in homicide. Now, how does a human bite mark look like? We can see here on this slide that the pattern is ovoid elliptical, the depth is superficial, there are abrasions in the injuries. Usually it's not more than 1 or 2 bite marks present, and the debris is quite rare. And the teeth, of course, are very unique in determining the bite marks because we all have a different stature of our teeth. The number of teeth present, the morphology, the shape, the size, the alignment, the arch form. So in a closed population, when we have in a household or in a room, and let's say in a kindergarten, where it is a question if the children had been the biter or perhaps the caretaker. So in a closed population, a bite mark can become a very valuable proof of evidence. The first case I would like to present to you is the case Daniela, which was in Budapest, a 2-month-old baby. The story is very, very grim, especially taking into consideration the tender age of the baby. The parents, both married, they had this child, and they were very young. The mother was 18, the father was 19, which is young for European standards, as people get married in a much higher age. The father came home from work and he was exhausted, and he sat and he wanted to watch TV, and the baby was next to him and started to cry and cry and cry. And after a while, according to him, he saw black and he started to beat the child. He was beating the child, and the child wouldn't stop, so he bit the child here on the upper arm and on the stomach. Obviously, the child wouldn't stop crying in pain, so he kept beating it and until the child was exhausted and stopped crying. The next day, the parents saw blood in the oral cavity, so they panicked. They went to the GP, and the GP gave some medicine, cleaned the wounds, and sent them back home. So here we have a problem. The problem number one, that the GP did not recognize that there was a child abuse case. He needed to detect the child abuse wounds, and he needed to report it to the police, and he didn't do that. That was on a Friday. A week later, again on a Friday, father comes home, same story, very tired, watches TV, child starts to cry, and this time he beats the child, takes the child, and from 2 meters throws the baby into the crib. In this process, the leg breaks, the child starts bleeding immediately, the parents panic again and take the baby to the GP again. Now, that particular doctor wasn't present, he had someone else in his stead, and he said, there's nothing I can do, you have to take the baby to the hospital. Second problem, that particular GP also did not detect and report child abuse. Now they arrive at the hospital, and in the hospital, the pediatrician, very smart guy, he immediately recognizes the child abuse wounds and signs. He takes the baby to the intensive care unit and asks the parents to wait in the waiting room. In the meantime, he calls the police, they come, they arrest the parents, and that evening of that particular Friday, I get a phone call to check my email because there are some pictures I need to see. There was an immense media attention. You can imagine a 2-month-old baby being so brutally abused is not normal. We had a week-old bite mark on the stomach that was not anymore proper for analysis because it was not visible anymore. And bite mark on the upper arm. I inverted the picture, as you can see, so that we can actually see the bite marks, the tooth marks in a better position. Now the problem here was that the father accused the mother and the mother accused the father. So they themselves were not on good terms, and they were accusing each other that the other one had bitten the child. So I took the impression from the father. Here we can see the model, the Gibbs model of the father. We can see that there were some missing teeth, and also that the upper right tooth is shifted, which is of course perfect for us to make the analysis. And on the left side you see the bite analysis of the mother, on the right that of the father. And on the left slide you can see that there is absolutely no match with the mother. On the right side there is quite a good match with the father. So here a close-up, and on this slide we can see it on the inverted picture pretty well. Now remember, the overlay is a static picture, you can say, of the tooth surfaces, which we put on the calibrated picture, and the picture comes from the bite on a soft tissue. So there are distortions, and we have to move the overlay to some degree. Here, tooth, the upper right tooth, which was in an awkward position, was the angle which showed us exactly the match. I sent this case also to my colleagues in the United States. They also did an independent analysis, not knowing the story behind the case, just knowing that it's close population, 2 people, who could it have been, and they came to the same conclusion. As I had mentioned before, there was immense media attention. They were all reporting about this case, and in a way it was not only news, but it was education for the general population to realize, okay, bite marks can be of evidential value in a close population. So this helped, of course, to the extent that a few weeks later we had another bite mark case of another baby. Here the mother went to work in the morning, and in the evening when she came back to bathe the child, she realized that there is a number of bite marks on the child's body, and she remembered the Daniela case from the news, and she realized, okay, this is evidential value that can help in finding out who the biter was. There were 3 suspects. One was the uncle, one was the babysitter, and one was the neighbor. Close population, these 3 people always hanging out together in the same household. Here we can see the bites on the stomach again, on the upper arm, on the back, and everything was measured, obviously, because we have to calibrate the pictures, and the 3 suspects, the teeth of the 3 suspects, and when the analysis was made, then the babysitter realized that there is no way out, and he confessed to having bitten the child. These are the 2 cases that I wanted to present to you. In general, it is my firm belief that if we can save 1 child from child abuse, we may be able to save a number of people in the future. Why? Because usually child abused children become abusers themselves. There's a high risk into that. So it is really our sacred duty as dentists, forensic odontologists, doctors, lawyers, police officers to rescue these children and to make sure that this beautiful future generation keeps healthy and intact. And with this quotation, I would like to close my mini lecture for you today, and I wish you good luck in all the work and services you do for society. All the best, and bye-bye.